This is the research handling overview for RETATRUTIDE. We'll cover cycling, dosing schedule, where to start based on your GLP history, reconstitution for the 4 vial sizes, and some research paired stacking suggestions. Cycling isn't strictly necessary with RETATRUTIDE, but it is recommended to avoid desensitization. A typical research cycle is 16 weeks of dosing followed by a minimum 8-week washout period. This rest window lets the receptors recover, preserving long-term effectiveness. RETATRUTIDE is dosed once every 7 days. Always dose on the same day of the week, and try to keep the dosing time consistent. It can be taken any time of day, but it's best paired with a light meal. Avoid dosing after a large meal or with alcohol, both of which can amplify side effects. Stay on each dose level for a minimum of 4 weeks before increasing. If at the 4-week mark you're still losing weight and still getting good appetite suppression, hold that dose. Only move up when the current dose stops producing results. This protects against unnecessary side effects. Where do you start? If you have never taken any GLP before, that includes semaglutide, tirzepatide, mazdutide, survodutide, liraglutide, or cagrilintide, your starting dose is 2 mg per week. If you have taken a GLP before and had at least 1 dose increase while you were on it, your starting dose is 4 mg per week. The body has already adapted to GLP signaling, so the lower starting dose is unnecessary. Now to reconstitution. For a 10 mg vial, mix with 1 ml of bacteriostatic water, which is 100 units on an insulin syringe. Dosing converts as follows. 2 mg equals 20 units 4 mg, 40 units 6 mg, 60 units 8 mg, 80 units, and 10 mg uses the full 100 units. For a 30 mg vial, mix with 2.5 ml of bacteriostatic water, which is 250 units. The unit conversions are 2 mg, 16 units 4 mg, 32 units 6 mg, 50 units 8 mg, 66 units 10 mg, 84 units, and 12 mg uses 100 units. For a 40 mg vial, also mix with 2.5 ml of bacteriostatic water. The unit conversions shift because the concentration is higher. 2 mg, 12 units 4 mg, 25 units 6 mg, 38 units 8 mg, 50 units 10 mg, 62 units, and 12 mg, 75 units. For a 60 mg vial, mix with 3 ml of bacteriostatic water, which is 300 units. The unit conversions are clean tens. 2 mg, 10 units 4 mg, 20 units 6 mg, 30, 8 mg, 40, 10 mg, 50, and 12 mg, 60 units. Some peptides are strategically stacked with RETATRUTIDE to break plateaus, preserve muscle, and accelerate body composition changes. Here are the most common research paired options. AOD 9604 increases lipolysis and helps preserve muscle during weight loss. BPC 157 and TB 500 support healing, especially for soft tissue and joint inflammation, which tends to flare up during rapid weight loss. GHK copper supports collagen production, skin tightening, and regeneration after fat loss. Semix and Celanc support mental clarity and mood, helping prevent the brain fog that some users experience under heavy appetite suppression. Glutathione provides detox support and liver optimization, which is helpful during fat mobilization. And LIPOC, lipotropic injections, enhance energy and fat breakdown when paired with metabolic peptides. To recap, cycle 16 weeks on, 8 weeks off, dose once weekly, start at 2 mg if new to GLPs, or 4 mg if experienced. Stay on each dose for at least 4 weeks. Reconstitute according to your vial size. Stack strategically to protect muscle and break plateaus. This video is for educational and research purposes only. It is not medical advice. RETATRUTIDE is an investigational compound, not currently approved for general use. Laboratory peptides are intended strictly for research and not for human consumption. Always consult a licensed healthcare professional before making any health decision. Thanks for watching. If you'd like a protocol breakdown for another peptide, drop a comment with which one.